long-term conditions, frailty and exercise. So the aims of the session are to think about exercise and long-term conditions, the physiology of age and pathology-related changes, frailty, predictors of frailty, exercise intervention for older adults and age-friendly communities. Long-term conditions would include type 2 diabetes, coronary heart disease, MS, COPD. Now what I would like you to do is have a think about picking one condition. Identify the benefits of exercise for your long-term condition, the risks associated with that exercise, and the challenges and barriers that you might overcome. So have a think back to the previous slide, select either type 2 diabetes, coronary heart disease, MS or COPD, and have a think about the following three. So plan a programme suitable for your allocated long-term condition. Consider the group or the individual, the setting, the training components, any application of fit principles, and describe and justify your programme. Definitions of ageing, so 65 to 75, young old, 75 to 85, middle old, and 85 and upwards, very old. VO2 max decreases by 5 to 10% each decade beyond the age of 50. VO2 max of 15 millilitres per kilo is needed for independent community living. So why does VO2 max decline? There's a decline in maximum heart rate, impaired compliance with diastolic filling, incomplete emptying and systole, decreased response to epinephrine, decreased lung elasticity and reduced airway capacity, and decreased capillarization. Neuromuscular changes in aging, so sarcopenia starts at the age of 25, accelerates beyond 65 years. By 80, 50% of skeletal muscle is lost, and loss of actual fibres rather than atrophy. Decreased androgens and other growth factors, selective loss of fast twitch muscle fibres, and less synchronization of motor units, which causes a deteriorating muscle quality and myosin function. Have a look at this slide in a little bit more detail. This is a sarcopenic cycle. So pause this slide here and have a think about sarcopenia and the impacts different physical levels, exercise tolerance, osteoarthritis, low back pain has on sarcopenia. Balance. So balance is affected by postural hypotension, impaired proprioception or sensation and vision, slower correcting reflexes, slower gait and increased displacement of the centre of mass, and polypharmacy. Indicators of frailty include exhaustion, weight loss of around about 5% per annum, sedentary behaviour, gait speed reduces, hand grip is also reducing. Again, take a look at this cycle, so pause the presentation here and have a think about the frailty cycle. So what's increasing and decreasing in relation to frailty? Thinking about the endocrine changes, any inflammation issues, any side effects, falls, isolation, osteopenia. Can we prevent frailty? So physical activity, aerobic exercise, strength training, using a good diet and social inclusion have all been shown to prevent frailty. And how reversible is the aging process? So exercise for older adults can reduce in increased muscle strength and balance, improved cardiorespiratory fitness and metabolism boosting, glucose tolerance is improved, therefore reducing diabetes, improved performance of ADLs and improved psychological health. Effective exercise prescription for older adults. Aerobic activity, it doesn't matter how, just get them a little bit out of breath. Strength training, focus on power, balance and coordination, flexibility, gait and weight bearing. Special considerations, however, would be a longer warm-up and a longer cool-down. Ensure adequate hydration. MSK overview, range of movement, pre-existing injury and degeneration. Screen cardiac, so avoid high-intensity activity if there's any signs of left ventricular ejection of less than 50%. Exercise-induced myocardial ischemia, ventricular arrhythmia, or systolic hypertension. BP, if their exercise is contraindicated if their BP is 200 over 115 at rest. Precautions would be diabetes, so you'd need to make sure you're monitoring glucose throughout. any adjustment in medication. They're wearing appropriate footwear. Thinking about avoiding BP increases beyond 200 millimeters of mercury systolic. Hypertensive medications, prolonged cool down period, and increased fluid requirements, so increasing their hydration. And then supporting cognitive decline, so thinking about dementia, the use of music and purposeful activities. Be spontaneous and adaptable to how that patient presents. Use non-verbal cues or demonstration, pictures, videos. And then think about age-friendly communities. So age-friendly communities is a World Health Organization initiative. Thinking about transportation, housing, outdoor spaces and buildings, social participation, civic participation, employment, communication and information, respect and social inclusion, and community support and health services. Now, what they want to do is be able to feed into each of these aspects to perform an age-friendly community. So what it might be worth doing here is pausing the presentation and having a look at what age-friendly communities are available around Sheffield.